Hello, everybody, and welcome to today's presentation. This is Raising Your MIPS Score and Online Reputation. My name is Randy Marsden, President of MarsdenAdvisors, and I also have with me today Hugh McClure, who's the Senior Solutions Consultant for Raider 8. Before we begin, our legal statement here is that this presentation is for informational purposes only. On today's presentation, we'll be covering the different ways your patient satisfaction and reputation data is used online. We'll be covering the MIPS impact on your reputation, as well as activities that support patient satisfaction. We'll also be working with Hugh at Raider 8 to show you how to automate patient satisfaction capture and how to use Raider 8 to support improvement activities in the MIPS program. The MIPS program is part of the Quality Payment Program, or QPP. There are two different ways to participate, either as a MIPS participant or as an advanced APM participant. Today's presentation will mainly cover MIPS, but there are some overlap with the advanced APM program. Now, if you are a participant of MIPS, you're aware that the thresholds continue to rise and the program continues to evolve year over year. Currently, for the 2022 reporting period, which impacts your 2024 payments, you need at least 75 points to avoid a penalty. And then at 89 points, you get an additional bonus up through 100 points on top of the existing payment adjustment awarded from those who score below 75 points. Starting in 2023, which impacts your 2025 payments, the exceptional performance bonus is removed. So it's strictly based on those penalized providers. So at this point, I think most practices are concerned about the payment adjustment, which is of course very important, but there are some other factors to the MIPS program that you want to be aware of, and that revolves around public reporting. If you aren't familiar with this site today, you should definitely check it out. We'll drop a link in the chat. This is the Medicare Care Compare site. Similar to a commercial plan or payer site, you can go and look up doctors in your area and compare them. So in this example, if we go ahead and take a look for ophthalmologists in my area, it will show me all the different practices. I can look at practices or doctors. And you'll notice that there is MIPS data available on this page, including which improvement activities were used. You can see all of the providers who are at the group and the locations. And then if you click on the performance section of quality, you'll see certain quality measures that came from the MIPS reporting. And as you can see here, there are some that are just 1 star. And for this practice, a 1 out of 5 on a glaucoma measure probably isn't the greatest thing to have out there. So improving your MIPS scores actually impacts what your patients are able to see. And when they're shopping around for a doctor, that may have an impact on who they choose. Now, I hinted at this earlier, but where does this data come from? So this is coming from your 2022 QPP data for what we are currently seeing on the Medicare Care Compare site for 2022 at the time of this presentation. For 2023, the data will be coming from 2021. So as you can see, the data is always 2 years behind. There is a preview period before this data is posted, and the current preview period is happening right now. That preview period started November 21st, 2022, and goes through December 20th of 2022. The preview period, we'll be going over how to access that, but if you checked your MIPS data for 2021 already, when that first became available and finalized in the summer, it's exactly the same information. It's just some measures are not displayed, and some measure information is changed to make it easier for a patient to understand. And all of this information is available on qpp.cms.gov. When you log into the QPP site, you will see a section called Doctors and Clinicians Preview. This will only be available during the preview period. So if you're checking this at another time, you won't see that. But if you did check your performance feedback for the prior year, it should have similar information. After selecting that, you'll then be able to select your group and choose View Practice Details. You can also look at individual clinicians' feedback using the View Individual Preview next to the clinician name. Once you've chosen the group or clinician that you want to review, on the left panel, you'll be able to switch between each of the categories, which is quality, promoting interoperability, and improvement activities. Actual cost measure data is not displayed, but the provider data catalog will list actual counts of services provided and that is only available in the public downloaded file or API. That will not appear on the public patient-facing website. As I mentioned earlier, the data is going to look a little different because the information and how it's scored and as you all know, can be very complicated, especially if you're not familiar with the program. So they do have some changes and what to expect when you look at this from a patient perspective. So first of all, anything that's a proportional measure, so this would be like having a numerator denominator with a performance rate that becomes a decile. Instead of having that score of 0 points to 10 points per measure, it's instead going to be displayed as a star rating up to 5 stars. And only certain measures will be displayed. So we'll drop in the chat the clinician and group measure lists so you can see exactly which measures are being picked up, as well as a star rating guide so you can understand how they're calculating that star rating. As we saw in the earlier slide, if you click on that down arrow next to the measure name, it does give some patient education on what that measure is looking for. And you'll notice that the measure name is not exactly what the measure name is that you're used to. So you're seeing here getting a report from specialist after a patient referral. This is the closing the referral loop receipt of a specialist report measure. For attestation-based measures, again, only certain measures and activities are displayed. So this could be like your security risk analysis for promoting interoperability or a improvement activity that you're using, like the ones that are listed here. And the full list is available in that same link that we provided before for clinicians and groups. This will just be a check mark. So it will just display the ones that you tested yes to, and the name and description might be different as well. So I don't have it on the screenshot here, but a very common one that practices use is the provide 24/7 access to MIPS eligible clinician or group who have real-time access to the patient's medical record. On the Care Compare site, you'll see that slightly renamed as providing 24/7 access to clinicians and groups who have access to patients' medical record for advice about urgent care. So again, don't really be confused about the name. It's just updated to make more sense to a patient. So some things to look at when you're reviewing this data and also when you're just deciding what you're going to report for MIPS. Definitely pick relevant quality measures that highlight the care that you provide and also validate them to make sure they're scoring correctly. So for example, you probably don't want to be reporting that closing the referral loop measure as, let's say, a ophthalmologist, because first of all, you're probably not referring out that much. You're usually the person who's referred to, and it's really out of your control. Obviously, you can work with that provider to get the data sent back to you, but if it's not sent back, you don't really have any control over that. And I'm using ophthalmology as an example, but that really goes for pretty much any specialty that has specialty-specific measures. That could also be like dermatology, orthopedics. There's a lot of quality measures that have been recently created that support specialties. So if you're continuing to use those general measures and you are not a specialist, you may want to reconsider. Otherwise, you're going to have a lot of extra data on your Care Compare page, and it might make you look bad, even though these are things that you normally don't treat. And then, of course, for the things that you do treat, the procedures that you do, you want to make sure that those quality measures are as accurate as possible and are scoring properly. Same thing with improvement activities. You want to pick the activities that are relevant to you that would be highlighted on that page. So the 24/7 access is a great activity, of course. We're going to go over some other activities that are great to use, and basically anything you want to highlight that your practice is doing, by choosing that improvement activity, it will show up on the Medicare Care Compare site. Besides the actual performance data, you also want to make sure your clinicians and locations are up to date on Care Compare. This is all coming from PACOS, so as long as you have PACOS up to date, then this will be up to date as well. Just keep in mind that any changes made in PACOS will be validated, and that takes 2 to 4 months. So if you do make a change, I would just note down when you made that change and maybe set a reminder, calendar reminder to go back and check. And if you see that it's after 4 months, it still hasn't updated, you can contact QPP. You can also contact QPP if you prefer that your DBA is listed instead of your legal business name. And to contact them, it's as easy as emailing qpp@cms.hhs.gov. So somewhat related, there are actually MIPS-related improvement activities that help support patient satisfaction. So we have two recommended activities listed here. The first one, collection and use of patient experience and satisfaction data on Access. This is a medium-weighted activity, and the objective here is to develop an improvement plan informed by patient experience and satisfaction data, including any differences across demographic groups, so that eligible clinicians can use data-driven approaches to improve patient access and quality of care. So if you are collecting patient experience and satisfaction feedback and developing an improvement plan to act on that, especially accounting for any differences in demographic groups, then this is a very easy activity to meet. Another activity, which is actually a high priority, is a regularly assess patient experience of care and follow up on findings. The objective of this activity is to improve patients' experience of and satisfaction with care by gathering and applying learnings from relevant data to make care more patient-centered. So it is very similar to the other activity, as long as you are regularly assessing the patient experience and you have a routine and you're keeping that consistent and you're applying what you're learning from that feedback to how you impact overall patient care and making your patient care more patient-centered, then that's a great activity to meet as well. For both of these, like I mentioned, the key is consistency and doing this across the board and keeping up with it and monitoring it and tracking it, which doing this manually can be very difficult. Luckily, there is a program like Rater 8, which beyond just the MIPS activity requirements, helps you improve your overall patient reputation and satisfaction on various sites, including Google. So I'm now going to hand it over to Hugh McLaren from Rater 8 to show you the platform, show you how that works, and then we'll come back over here and show you how to apply what you do in Rater 8 to meet those MIPS improvement activities. Take it away, Hugh.
Hello, everybody. This is Hugh McLaren with Rater 8. I am a senior solutions consultant. I'm happy to speak with you today. This presentation shouldn't take too long, should be about 10 minutes or so, and then we'll do some Q&A afterwards. So as Randy has mentioned, Rater 8 is a healthcare-specific reputation management company. So what that means is that we only work in the healthcare space. And what we do is we help groups, practices, hospitals, healthcare systems make sure that they have a great reputation when patients are searching for them. And also, as Randy has mentioned, we also do patient satisfaction surveys. So in order to meet those MIPS measures that Randy has discussed, we give you the tool to give your patients surveys about their experience. Then we give you some really cool tools to look at that information and make decisions to improve the patient experience. So let's jump into it. It's pretty easy stuff, and hopefully you will see some cool things today. So first off, just wanted to start here. This is the Rater 8 dashboard. So with Rater 8, you will have a dashboard where you'll have all of your physicians and locations and listings. You'll be able to see all of the internal as well as the external feedback that you're getting from our reviews and surveys coming into here. But really, I want to start with the patient experience. So when you think about it, when we're talking about the patient surveys and meeting those MIPS measures, really what we want to do is we need to give the patient a way to leave feedback about their patient experience. And so what we do is we will integrate into your practice management system. Really, it's just a simple appointment report. We just want to know what the completed appointments are. We'll take that information, and then that's what we use to send either a text or an email to the patient to ask for that feedback. And so this is an example of what the survey might look like here. So you can see the patient gets an email. You can see the physician that the patient saw that day. And then all it's saying here is tap for a rating. So it's just a one click for the patient. They'll tap on a star here. And then what we do is we open up what we call a micro survey. And this, obviously, as you can tell, I'm on my computer, but this is all mobilely optimized. So if the patient's on their cell phone, it's easy for them to read and tap and fill this out. But typically what we'll do is we only want to give the patients about 4 questions to answer. So you may have 10 or 12 questions total about the patient experience that you want to get feedback on. What we're going to do is we're going to randomize it for each patient and only show them 4 questions. And we do that for response rates, right? If a patient sees, 10, 12 questions, sometimes they get overwhelmed. They're like, no, that's going to take too long. I'm not doing it. And they won't fill it out. So we want to make it easy for the patient. So what they can do is as they go through this little survey, they can click on a star rating and then it opens up a comments box. So they can leave a comment about each aspect of the experience that they're being asked about, which is nice. The other thing that we do have available, because this is an anonymous survey, if they tap, let's say, something less than 3 stars, when they go to submit this review, what'll happen is they'll get a little pop-up, and that pop-up will say, hey, we strive for 5 stars. Would you like to share your name and email? And then the point of contact at the practice will get an alert that a patient has shared that with them, and it gives you an opportunity for service recovery. So that's really as simple as it is. Once the patient has filled that out, all that information is coming back into the Rater 8 dashboard here. And this is where we really give you some neat tools to understand this information. So you can see in the dashboard, you'll see this Rater 8 logo. That's going to be a comment that was left on that internal survey. But beyond that, what you can do is we have what we call a benchmarking tool. So here in the benchmarking tool, these are all the questions that this practice asks. You can see here, this is their average rating that they're receiving on each one of those questions. Well, what we do is we also benchmark that, right? It's one thing to know if you're doing good, but how does that compare to others? So it defaults to the Rater 8 benchmark. That's for all of our clients. That's the average rating on the question. But oftentimes in ophthalmology, you're going to want specific to ophthalmology. And so what we can do is then have a benchmark for just our ophthalmology clients. So we've got about 30 to 40 different ophthalmology practices across the country that use Rater 8. And so this is the ophthalmology specific benchmark, but you can also have benchmarks for your city or your region or similar sized practices. So it really allows you to compare in a meaningful way. The other thing that's nice is if you have multiple locations, you can click the location filter, and then I can see how is my check-in experience differing across my different locations. And then beyond that, you can say, okay, well, this one seems to be a little lower. Let's look at the comments. And so what the system will do is it will open up and show us the comments that are specifically related to just that question at just that location. So hopefully here this internet connection will speed up for me and it'll show me the information. There we go. So you can see here, it'll just show me the comments that are just related to that location. So if there's anything I need to understand, that's happening differently there, it's easy for me to get to that data. This is all exportable to an Excel file. So if you needed to show any proof for attestation reasons, you can export that. You can also show different things like response rates. So if you needed to export to show how many surveys you sent out and how many were returned, you can get that information pretty quickly. So that's kind of how the surveys work. Now, beyond surveys, what Rater 8 is really good at is helping practices to make sure that their online reputations are great. And what I mean by that is when patients are searching on Google for best ophthalmologist near B or best medical practice near me, that your group has the highest reputation with the most reviews. That's really what we're going for. The other thing that we look at too is it's important not only for you to have a good reputation on Google, but also the other sites like Healthgrades and Vitals and WebMD. And it's mainly because we don't want to give patients any reason to think that, the provider looks good on Google, but why are they only 1 star on Healthgrades? So what we do that's really different than any other company is we've developed an algorithm. And so what happens in the algorithm is the patient gets that email or text, and then they just click rate your experience. And so when they click rate your experience, what our system does is it looks at all the listings, right? Because your doctor has a personal listing, there's a location listing, and then all the other personal listings for the provider. What we do is we set goals in the background for each one of these listings. And then before the patient even clicks, our algorithm looks at the real data. So real time, what do all these listings look like? And so in this scenario or this example, you can see that the goals for the location listing are all being met. So what the algorithm's automatically going to do is it's probably going to send to the personal listing because we haven't had a review in over 7 days. So it's been 10 days. So we want to make sure we get a review on that listing. So it'll automatically direct the patient to that listing. And so what that looks like for the patient, similar to the survey email that they might get, they just click one time and then the system is automatically going to figure out where that review needs to go and send the patient to that listing. So the easiest way I explain that is what Rater 8 does is it sends the patients to leave the review where it's needed most and makes it really easy for them. And so the byproduct of that, there's a little handy report in Rater 8, we call this the online review scorecard, is when you look across like this group who's been using Rater 8 for a couple of years now, you can see that all of their listings look really great, right? There's no discrepancy in any of these. All of their doctors have great reputations. All their locations have great reputations with tons of reviews. And that's really kind of the goal of our service. Other kind of nifty things that Rater 8 can do for you. We do a testimonial widget. So all these really great 5-star reviews that you're getting, we want to make sure that those can be viewed easily for the patient outside of just Google. And so we can do a testimonial widget on the provider bio page. So you can see here on Dr. Nam's page, we can see this testimonial widget populating all those 5-star reviews right there within your own website. And that's a really easy just piece of code that we would give to your web developer to embed there. Of course, in Rater 8, the other thing that you're going to be able to do is, see the, results that you're getting. So understanding kind of how is the distribution between 5 stars and 1-star reviews? How many reviews are you getting? What kinds of reviews? What sites are they coming from? That's important. And then lastly, the other thing that, we make easy for you with Google is you're able to respond to Google reviews directly out of the Rater 8 dashboard. So Google loves to see when businesses engage with their Google listing. And so this way, it's really easy for you to just open up the dashboard. You have all of your listings loaded in here, and you can respond to those Google reviews directly out of the dashboard. So hopefully, this demo was really quick today. I'm happy to schedule more time with anybody who wants to kind of schedule an appointment. But if you have any questions, please ask them in the Q&A section. And it's been really great talking to everybody. Thank you so much.
Thanks, Hugh. Now let's go over how to implement these activities and how to use Rater 8 to meet them. For the collection and use of patient experience and satisfaction data on Access, this is looking for collecting patient experience and satisfaction data on access to care and development of an improvement plan, such as outlining steps for improving communications with patients to help understand urgent access needs. The validation documentation is available on the QPP resource library site. It's hidden deep in an Excel file, but we've made that easier by putting that on our ValView website, which we're including in the chat right now. The validation documentation is really important to be looking at for any activity that you choose. This we often find practices aren't aware of this, but the validation documentation tells you exactly what you need to have prepared in the event of an audit. So when you're attesting yes to an activity, you are basically saying that you have all of this available. So even if it's not these activities, make sure you check that. And you can check those on our ValView site for any activity to make sure you have the right information ready to go. So for this, you'll need a documented improvement plan with goals for access to care and quality based on patient experience and satisfaction data. You'll need both of these elements. The first is patient experience and satisfaction data on access to care. So this is data collected through a patient experience survey. For example, eligible clinicians could give us the survey to all patients that were seen during a certain period or a certain location. The data can be prepared in any useful format or as they were collected. The second item is an improvement plan. So this is documentation of an improvement plan, which should include specific activities, goals, and outcomes for addressing access to care. For example, in looking at the check-in experience rating by location that Hugh showed, you may identify one location scoring lower than the other. In reviewing the comments, you find that the issue is with wait time. You would then implement an improvement plan, such as adjusting schedule templates, adding additional clinicians or staff to the location. You can then use Rater 8 to reassess the changes as they're made to see if the access to care was improved as a result of these changes. So in summary, Rater 8 can help you meet that first element of gathering that data, but you'll still need to work on improvement plan and track that separately. Keep in mind that this activity is centered on access to care. Now, this activity, regularly assess patient experience of care and follow up on findings, is more broad than just access to care. The validation documentation for this one is also available on our ValView app, and we'll link that, which is coming straight from the resource library data. So for this activity, you're collecting and following up on patient experience and satisfaction data. This activity also requires follow-up on findings of assessments, including the development and implementation of improvement plans. To fulfill the requirements of this activity, you'll use surveys like the CAP survey, advisory councils, or any other mechanisms. The clinician may consider implementing patient surveys in multiple languages based on the needs of their patient population. For this validation documentation, you only need 2 of the 3 elements listed here. The first is a report of patient experience and satisfaction. The report includes patient data on patient experience, satisfaction. Like I mentioned before, it can be a survey result, and you may use a third-party administrator. So for this one, you should be able to get from the Rater 8 dashboard. The next item is follow-up on patient experience and satisfaction. So this would be documentation outside of Rater 8 that you've implemented changes based on the results of the patient experience and satisfaction data gathered or analyzed, which could be specific improvements made to practices and processes in response to the survey results. Or you could have a patient experience and satisfaction improvement plan, which is documentation of what you would do to improve. So both 2 and 3 look pretty similar, but just keep in mind, item 2 would be as if you actually were able to make the changes during that time frame and that you were able to follow up on results. Whereas the third option would be putting together that plan of what you are going to do, and that actually implementing those changes may follow. So an example here, let's say a practice offers patients the option to fill out a questionnaire after their visit using Rater 8, for example. The practice finds that there's multiple complaints about a clinician, including poor listening skills and a tendency to rush in and out of the room so fast that questions are not answered. The practice creates an educational plan for that clinician and also identifies and addresses environmental issues or provides support to address personal issues that lead to the eligible clinician to feel pressure to rush through the patient visits. The report of patient experience and satisfaction data can come from Rater 8, and that follow-up or improvement plan would be based on those findings. This example, by the way, is an exact example from the validation documentation. So using the validation documentation to identify what the meaning of this activity is crucial. And as you can see, based on what we looked at in Rater 8 and the ideas that we have for follow-up and plan, it's definitely doable using both that platform and our prescribed improvement plan strategy. Which brings me to the final piece of information across all of these improvement activities, and that's the documentation is key. Now, none of the documentation requirements that we've covered are required to be submitted along with your MIPS submission, but we highly recommend preparing this in real time. For example, if you are audited 5 years from now, are you going to remember how you were meeting this activity? What if the people meeting this activity or working on it are no longer here? You want to make sure that you have all that documentation in what we call an e-binder, which is just a folder containing everything that we use to submit that MIPS report, including reports from the EHR, reports from the registry if you're using that, as well as this improvement activity proof, security risk analysis, safer guide, so on. At MarsdenAdvisors, we work with our clients to prepare all of that proof and documentation at the time of submission, so that if there is an audit, we're already one step ahead. Documentation is not the only thing we do, so we are a full-service MIPS consulting group where you can outsource pretty much the bulk of the MIPS reporting to us. Unlike other MIPS advisory services we've seen, we are taking on pretty much all of the reporting burden that you would have. So we're getting connected into your EHR registry, identifying areas for improvement, looking at the services that you provide and finding the best measures to make sure you're reporting the best measures that are the most relevant. We help train you and your staff. You have a dedicated client success manager that can help any of those burning MIPS questions that pop up throughout the year. We are working with your EHR and registry to identify any technical issues to make sure that those scores are accurate. We're also auditing the measures throughout the year to identify if there are technical issues or if there's training issues that need to be worked on. And then we are able to submit pretty much through any method that you choose. So if you're using a registry or you have built-in reporting with your EHR, we're able to support all of those. So just to wrap up before we go into Q&A, if you'd like to learn more about MarsdenAdvisors, just emailing us at getstarted@MarsdenAdvisors.com. We can set you up with an advisor that can help talk through your specific situation. We are offering special pricing through the end of the month, and that is 20% off 2023 reporting and the free review of your 2022 submission. So at this point, we really can't do the 2022 submission for you, but we can definitely take a look at what you're planning on submitting, making sure you have documentation and that everything checks the right boxes so that you're safely submitting in the new year. Also keep in mind, we have an upcoming webinar, MIPS in 2023. The final rule just came out and we have taken that and digested it and made it very simple and easy to understand as best as possible. That is Friday, December 16th at 1 p.m. Eastern time, and we will drop a link to that webinar in the chat as well. If you're interested in learning more about Raider 8, you can schedule a demo. We'll also be including a link here. And with that, I will leave it to anybody in the Q&A. Let's see if we have any questions. And also, if you have not submitted a question yet, you can go ahead and do that. We'll stay on the line and make sure we get all of those answered.